All right, you guys. So we're about to jump into a whole new arena of content when it comes to disease management, when it comes to taking care of our patients. And what we're going to do is we're going to spend some time looking at different diseases, different conditions, different syndromes, and how we as respiratory therapists play a part in the care team and taking care of the patients with these conditions. So before we get into the full treatment of the conditions, one of the things that we have to understand is just some terminology. And what we're going to start with that is etiology, pathophysiology, clinical manifestations. And so that is where we need to start. That is where we need to understand these three hot topics before we can get into treating or making recommendations for our patients. So let's jump into that. So when we look at etiology, etiology refers to the cause or the origin of a disease or a condition. And think of answering this question: why did this happen? And when we do this, etiology can actually be broken down into several different categories. So it can be genetic, it can be environmental, or sometimes we can look at idiopathic causes of conditions or diseases. So when we look at genetic factors, an example of a respiratory disorder or a condition or a disease that is genetic in nature would be the mutations in the DNA that are associated with cystic fibrosis from the CFTR gene that's been mutated. So cystic fibrosis would be an example of that genetic factor causing a respiratory disorder. Another one that we look at is environmental factors. So these are external influences such as like being exposed to toxins or allergens or infectious agents. Smoking is a well-known cause of lung cancer, and that changes the makeup of the lungs themselves. So environmental factors being those toxins, allergens, or infectious agents. So idiopathic. So this is, by definition, is the term is of an unknown origin. So even though we've gone through all of our investigation, we've looked at it from a number of different perspectives, we still just don't know where the origin is. So we can call the etiology idiopathic. And understanding the etiology is the foundation for preventing and targeting treatment for the strategies that we would make recommendations and carry out for our patients. When we look at pathophysiology, well, patho is a term that's describing the biological and physiological processes. So when we look at pathophysiology, this is a term that describes the biological and physiological processes that occur in response to a disease or a condition. In simple terms, it's what happens to the body when a disease develops. So when we talk about asthma and we talk about the etiology, that might be having an exposure to an allergen that leads to pathophysiologic response being inflamed airways, bronchoconstriction, excessive mucus production, all of those leading to a narrowing of the airways, causing the patient to have trouble breathing. When we look at pathophysiology, this is kind of the bridge. It bridges the gap between etiology and clinical manifestations, helping us understand how the disease progresses and affects the body. So when we look at pathophysiology, what we're looking at is that bridge or that gap between etiology and clinical manifestations. So for the example we have here with asthma, some of the clinical manifestations, you might have that patient may have a cough, they may have wheezing, they would have elevated vital signs. Those are all parts of the clinical manifestations that we're going to get into right now. Now, we're really not getting into the clinical manifestations of asthma, but let's use cystic fibrosis as an example. So these are the signs and symptoms that result from a disease process. Now, you may be saying, how do I differentiate between signs and symptoms? Well, when we differentiate between signs and symptoms, we're talking about objective versus subjective information. So signs would be something that we observe during the physical exam, such as a fever, rashes, abnormal breath sounds, vital signs. All of those can be objective in nature. Now, when we look at the symptoms, on the other hand, these are subjective, and they are what's reported by the patient. And that could be like fatigue or chest pain or shortness of breath, something that the patient is using to describe how they're feeling. So now let's look at cystic fibrosis. Cystic fibrosis is a great example because it impacts so many other organ systems besides respiratory. So when we look at the respiratory systems the respiratory system that's impacted and the signs and symptoms that are associated with it, they can have a chronic productive cough. They have recurring respiratory infections. They're known to be wheezers and to have shortness of breath. So lots of signs and symptoms. Persistent sinusitis and nasal polyps. These are all different signs and symptoms that we see that are associated with cystic fibrosis. Other organ systems or body systems that are impacted would be the digestive system. These patients struggle absorbing their caloric intake, their nutrients that they consume. They struggle breaking those down, and they struggle gaining weight. They struggle growing, and this is all due to the malabsorption that takes place as a result of having that genetic mutation. The other thing is these patients typically have frequent greasy, bulky stools that are from an insufficient pancreas. So their pancreas not working the way that it's supposed to. So they have another kind of telltale sign when it comes to clinical manifestations. The last one that we see here are kind of those other systems with excessive chloride loss when they sweat. So when that happens, when you have that excessive chloride, they have salty tasting skin, and so they can taste an excessive amount of salt. And we'll talk about some of the tests that we do for CF patients. Another thing that we see with CF patients is they have digital clubbing. This is a result of chronic hypoxemia, and we see their digits in their fingers and their toes having digital clubbing. The last thing we need to understand here is, why are these so important, right? Our good friend respiratory coach always says why is greater than how, but why? So why are etiology, pathophysiology, clinical manifestations so important? These concepts are the cornerstone for clinical reasoning. They allow healthcare professionals to identify the root cause of the condition, understand how the disease affects the body, and recognize and interpret patient presentations. So by mastering these principles, you can provide more accurate recommendations for the treatment plan based off the potential diagnosis this patient has. Now, as respiratory therapists, we cannot diagnose. We leave that to the mid-levels and the doctors. But our good friends that are now APRTs, they've moved into that mid-level position, and they can actually diagnose. So they understand the etiology, the patho, and the clinical manifestations super well. And so not only can we help provide recommendations for a potential diagnosis, but we can also recommend effective treatments and anticipate any of the complications that may be associated with the condition at hand. So I hope this makes sense. This is a generic overview of those three major topics: the etiology, the pathophysiology, and the clinical manifestations. And we need this because we need to make sure that we get the patients on the right path for the right treatment plan so that they can be discharged even sooner. So yes, it is well within our wheelhouse to recognize the etiology, patho, and clinical manifestations. And this is a major part of your diseases class that you will be taking in a respiratory therapy program.